This is Dr. Wright, and this is part 1 of the gross anatomy of the normal lung. Why do you actually even need to know about lung anatomy? Well, you need to know it to interpret chest x-rays and CT scans as a physician. You need to know it because there are diseases which are specific to the various portions of the lung, and you need to know it to understand disease processes and how they manifest themselves. So the learning objectives in this first part is to describe the overall surface anatomy of the lungs, to recognize how it's reflected in the chest x-ray and the CT scan, and to recognize the various segments of the lung. In this rather simplistic cartoon, it shows that the left lung is composed of two lobes, upper and lower, whereas the right lung has a middle lobe as well. The anatomy is slightly different because the pulmonary artery in the left lung tends to be superior to the bronchus, whereas in the right lung it's much more anterior to the bronchus. In this cartoon, which is a little more complex, it shows the trachea coming down, the bifurcation of the airways, and that the right mainstem bronchus is slightly larger and comes off a little bit straighter than the left mainstem bronchus, which is why foreign bodies tend to go into the right lung rather than the left lung. The lungs are separated from the chest wall by a pleural space, which is defined as that area in between the visceral pleura on the surface of the lungs and the parietal pleura, which is on the surface of the chest wall. You can see in this anatomy that the aortic arch is right about the same area as the bifurcation of the trachea into right and left mainstem bronchi. The pulmonary trunk is below this, and the bronchus comes off slightly inferior to the pulmonary trunk on the left-hand side, so that there is a space called the aortopulmonary window, which is an important space when one is assessing lymph nodes and lymph node enlargement in that area. You can also see the relationship of the heart to the various portions of the lung, and this is also important when you're considering the lung segments, whether they obscure the heart border or they do not obscure the heart border. On this chest x-ray, which is marked to show the differences of the various lung structures, you can see that the mainstem bronchus comes down here and is separated, just as I showed you in that pictorial area, right about the same area as the aortic arch. The lungs are divided by the greater fissures on both right and left side, which are actually fairly low down when seen on a standard PHS film. The minor fissure comes across here, and that's important when one is considering lung anatomy. This is seen a little bit clearer on this area where it's colored. Here are the major fissures coming down here and down here. Here is the right middle lobe, and you can see that any infiltrate in that right middle lobe might obscure the right side of the heart border. The left upper lobe and the lingula, which on a straight PHS film is actually fairly low down in the film. On this CT scan, once again, you can see the relationship of the lung lobes. Here is the greater fissure on the left, so this is just part of the lower lobe can be seen here. Here's the greater fissure, here's the minor fissure, and here's the middle lobe on this slice of the CT scan. You can see here the bifurcation of the trachea into the mainstem bronchi and the relationship of that bronchus to the aorta and to the pulmonary artery. This is another colored slide which shows again what one would see on a chest x-ray looking at the lateral aspect. In the right lung, here is the lower lobe, the upper lobe comes across here, and here's the middle lobe in relationship to the two of them, with the major fissure coming here and the minor fissure coming here. The left lung is a little more simplistic because you only have the greater fissure, and the lingula would be down here in this area, corresponding to what you saw on the PA view. This is a CT scan cut, which again shows this. Here's the left lung with the greater fissure. Here's the right lung with the greater fissure and the minor fissure indicating upper lobe, middle lobe, and lower lobe. Here's a picture which shows that the lung is not only divided into lobes, but is also divided into lobe segments, and that they're slightly different in the right and the left lung. For instance, in the left lung, one has a lingula, which is divided into superior and inferior aspects, instead of what one sees in the right lung, which is the middle lobe, divided into the medial and lateral aspects. The lower lobe is divided into various segments: superior, anterior, medial, lateral, and posterior. You can see that they're slightly different from side to side as one examines the different areas. This is a pectoral area of the bronchi, which leads to this, and it also shows that bit that I told you about before, where the right lobe, right mainstem bronchus, is straighter and slightly larger than the left mainstem bronchus. So the learning points in this first video was to show you the anatomy of the chest cavity, to show you the gross anatomy of the lungs and the difference between them, and to show how this anatomy is reflected on chest x-rays and on CT scans. These are the questions. Here's question number 1. The answer to question number 1. Question number 2. The answer to question number 2. Question number 3. The answer to question number 3. Question number 4. The answer to question number 4. Question number 5. The answer to question number 5. Question number 6. And the answer to question number 6. I hope you enjoyed this first part of the normal lung lecture series.